I'd like to say a few words about BJ because I was lucky enough to have known her and worked with her. We shared a special bond because we found out that we were both born in the same hospital in Jacksonville, Florida. And BJ grew up in Florida, went to Princeton for college, where she graduated magna cum laude. She then went to Duke for medical school and residency, and spent the rest of her career at the University of Pittsburgh. And her practice was devoted to treating sinus and allergy. And she did many things along the way. She raised 5 children, 2 of whom are physicians, and accomplished many great things. Much of her work changed the way we practice medicine and changed the way we conceptualize sinus disease. She didn't just work though, she was very adventurous, traveled the world. She was always seeking new experiences, and I remember once she took me and Jack Fernadley on a mission to go find a special chocolate store that made authentic Aztecan chocolate, and then took us to a restaurant that served up pan-fried corn smut. She sought out those experiences, and I think gives us an example of how we ought to be living our lives, accomplishing what we are capable of, pursuing our passions, and getting the most out of life. And you know, at the end of our days, after we're gone, what we accomplish for ourselves doesn't matter much. What really matters is how we have influenced others. And many of us in this room can remember the influence that BJ had on us. And so we want to celebrate her life and remember her in this lecture. So it is my distinct honor to introduce you guys once again to Drew Bird, who spoke at our annual meeting in Dallas in 2015. Dr. Bird is a pediatric allergist immunologist, now an associate professor at UT Southwestern Medical Center in Dallas, and his practice focuses on food allergy. As many of you all are aware, food allergy is a hot topic these days, and we need to keep up with this rapidly changing field. And we are very honored to have you, Dr. Bird, come and give us some important updates. Thank you.
Thanks. Thank you for the introduction, and it's really an honor to, especially to be the recipient of a memorial lecture and to be here with you guys again. It's hard to believe that was 2015. Doesn't seem that long ago. The title of the talk is the proof in the pudding? And I think that's an inside allergy joke a little bit in my title, I realized after I put it up. But a lot of the food challenges that we do for these studies involves a pudding matrix to blind the food we're making these kids eat. So before we dive in, I want to kind of give you the frame of reference of a patient you may be seeing in your practice and the type of conversation you may be having. The goal really of today's talk is to prepare you for those conversations because parents are asking a lot of questions and there are still a lot of unknowns, but things that we can certainly take from what we have learned to guide our patients better in trying to understand what therapies might be best. So Julie's an 8-year-old female. She had been diagnosed with peanut allergy early in life. So at 14 months old, she ingested some peanut butter and had diffuse urticaria and vomiting almost immediately after ingestion of some peanut butter, the very first time she had it. She had specific IgE testing using the ImmunoCAP platform that showed a very elevated specific IgE to peanut that was clearly indicative of allergy and indicative that she's likely still allergic. Skin testing was performed with a large peanut skin prick test wheel diameter, also suggesting she's likely very, very much still allergic, and that hasn't gone away. She's had no accidental ingestions. Parents have been really, really careful, and no use of auto-injectable epinephrine since her initial diagnosis. And so mom is aware of the current recommendations to avoid peanut, and she asks you if you think any treatment recommendations might change in the next few years, because right now we avoid, but the fact that she hasn't had a reaction in the past 8 years isn't just a flippant thing to think about. Really, this patient has had to be very vigilant. The family has had to tell everyone everywhere they go she's allergic to peanut. They've had to carry auto-injectable epinephrine everywhere. It's really modified their ability to send her to relatives' houses, overnight, to friends' houses, to camps away. So she's really having to be very, very careful everywhere she goes to avoid peanut. And so mom is really interested. What can I do to make our quality of life better and to minimize the risk of her having a bad reaction to peanut?